In the association, we have decided that every month we'll keep CME. So in the February month we had held CME, in the March last month, and in April. Today we are going to raise a knowledge on rabies and its prevention. So on behalf of Ayurvedic Homeopathic Medical Practitioner Association Godhra, I welcome you all. Today's speaker, Mr. Roy Cherian from Bombay, and he is having a vast experience in anti-rabies vaccine, and he is attached with the Sanofi Anti-Rabies Vaccine Institute, and having a very good knowledge on rabies and its prevention. So really today we are very lucky that we are going to get knowledge from such a person. I welcome all doctors. I welcome Mr. Shailendra Misra, DSL Juveniles Healthcare Limited, Mr. Amar Somarchi, RBM Juveniles Healthcare Limited, Mr. Sapan Jaiswal, ABM Juveniles Healthcare Limited, and Mr. Jay Singh BO, Juveniles Healthcare Limited. I request our President Sharma sir to say a few words on this occasion. In the March month, we had arranged CME in the Hotel City, where we got good knowledge on critical care management. I request Sarma sir to say a few words on this occasion. Good evening, everyone. Good evening, all doctors and wellness officials. અત્રે પધારેલા આયુર્વેદિક હોમિયોપેથિક મેડિકલ એસોસિએશનના ડૉક્ટર મિત્રો, બહેનો તથા જુવેલર્સ ફાર્મામાંથી પધારેલા તેમના ઓફિશિયલ્સ શ્રી શૈલેન્દ્ર મિશ્રાજી, श्री सोमलजी जी, श्री सपन जयस्वाल जी तथा श्री जयेश सिद्धल जी। मित्रों, आज आपने भेगा थवानुं सौभाग्य जुवेल्स फार्माथी मळ्युं ते बदल हूँ सौथी पहला बधा मित्रों ने आवकारूं छुं। जुवेल्से आपने बधाने मळवानो मोको आप्यो, आपने बधाने भेगा थवानो मोको आप्यो, ते बदल હું તેમનો ખૂબ ખૂબ અભિનંદન કરું। મિત્રો, આ વર્ષમાં આપણે નક્કી કર્યા પ્રમાણે કે આપણા સંગઠનને મજબૂત બનાવવું છે, આપણું સંગઠન એક કરવું છે અને બધા જ ડૉક્ટર મિત્રોને જોડવા છે। એના અનુસંધાનમાં આપણે આપણા કંઈક ને કંઈક કાર્યક્રમ કરતા રહીએ છીએ અને મિત્રો, આ બધા જ કાર્યક્રમ આપણે એકબીજાના સહયોગથી, સહકારથી આપણે કરી રહ્યા છીએ। એ વિચારધારાવાળા મિત્રો બધા ભેગા થયા છે અને એટલા માટે આપણું નાનું વૃક્ષ એ વિશાળ વૃક્ષ બનવા તરફ જઈ રહ્યું છે. અને મિત્રો મને કહેતા આનંદ થાય છે કે નવી કારોબારી ટીમ તથા દરેકે દરેક ડૉક્ટર મિત્રોના સાથ સહકારથી અત્યારે આપણે 158 ડૉક્ટરો આપણી પાસે મિત્રો આપણા મેમ્બર છે. એટલે હું અત્યારની કારોબારી તથા ભૂતકાળના દરેકે દરેક પ્રભુશ્રીઓ, ડૉક્ટર મિત્રો, મેમ્બરશ્રીઓને ખૂબ ખૂબ અભિનંદન આપું છું કે તેમને આટલી વિશાળ સંખ્યામાં આપણને અહીં સુધી પહોંચાડ્યા. અને મિત્રો આપણે આ વૃક્ષ હજુ પણ વિશાળ બનાવવું છે. એના માટે આપણું સંગઠન, આપણી શક્તિ એ આપણે કામે લગાવવી પડશે, ખૂબ મહેનત કરવી પડશે અને આપણે આગળ વધવું પડશે. અને મેં આગળ કહ્યું કે આપણે જે આ પ્રોગ્રામ કરીએ છીએ આપણા મિત્રોના સાથ સહકારથી કરીએ છીએ. ભલે વિગત અત્યારે હું છું પણ જોઈન્ટ લોસનો જે પ્રોગ્રામ ગોઠવવામાં આવ્યો એમાં આપણા સિનિયર ડૉક્ટર મિત્ર ડૉક્ટર વાંચીપુરા સાહેબે ચર્ચા કરી અને ચર્ચા કર્યા પછી મારી સાથે ચર્ચા કરી અને આપણે આખો પ્રોગ્રામ ગોઠવ્યો છે. એટલે મિત્રો હું બધી જ ક્રેડિટ આપણા ડૉક્ટર મિત્રોને આપું છું, કારણ કે આપણે આ વૃક્ષ આગળ વધારવાનું છે, આ સંગઠન મજબૂત બનાવવાનું છે અને આપણા સંગઠનની શું શક્તિ છે એ જે બે ત્રણ મિત્રોને થોડા સમય અઠવાડિયા 15 દિવસમાં કંઈક નાના નાના પ્રોબ્લેમ રહ્યા એમાં એ લોકોને પણ રિયલાઇઝ થઈ ગયું કે સંગઠનમાં શું શક્તિ છે. એટલે મિત્રો સંગઠન એ જ શક્તિ અને સંગઠનના કારણે આપણને ભેગા થવામાં મદદરૂપ થવામાં સુવિધા સ્થાપવામાં મદદરૂપ થઈ છે. તે બધા તેમનો ફરી હું આવકારું છું, દરેક ડૉક્ટર મિત્રોને આવકારું છું. અસ્તુ બંને માટે
થેન્ક યુ શર્મા સર. શર્મા સાહેબે કીધું પ્રમાણે આજનો CME ટોટલ વોઝ સ્પોન્સર્ડ બાય જુવેન્ટસ ફાર્માસ્યુટિકલ, જુવેન્ટસ હેલ્થકેર લિમિટેડ. સો on behalf of association we welcome them all and આપણા હિન્દુ સંસ્કૃતિ પ્રમાણે આપણે પુષ્પવૃત્તિ સ્વાગત કરીશું. તો આજના સ્પીકરનું સ્વાગત કરવામાં આપણા પ્રેસિડેન્ટને વિનંતી કરી શર્મા સાહેબને કે મિસ્ટર રોય ચેરિયનનું પુષ્પવૃત્તિ સ્વાગત કરશે. શર્મા સાહેબ.
હમણાં બહુ સમય મિસ્ટેક થઈ ગઈ કે મિસ્ટર રોય ચેરિયન આપણા માટે સ્પેશિયલ બોમ્બેથી બતાવ્યા છે. એમના માટે એક જોરદાર તારીખ છે.
ડોક્ટર મનોજ રાણા, વાઇસ પ્રેસિડેન્ટ, વિનંતી કરીશ કે તેઓ મિસ્ટર શૈલેન્દ્ર મિશ્રા સાહેબનું પુષ્પવૃત્તિ સ્વાગત કરશે. મિસ્ટર શૈલેન્દ્ર is DSM Juventus Health Limited. ડોક્ટર વાજુપુરા સાહેબને વિનંતી કરીશ કે તેઓ મિસ્ટર અમર સોમવંશી સાહેબનું સ્વાગત કરશે. He is RBM Juventus Health Limited. ડોક્ટર કનોભાઈ જોશીને વિનંતી કરીશ કે તેઓ મિસ્ટર સપન જયસ્વાલનું, જેઓ ABM Juventus Health Limited, સ્વાગત કરશે. ડોક્ટર આરકે પટેલ સાહેબને વિનંતી કરીશ કે તેઓ મિસ્ટર જયેશ સિંહભાઉ, BM Juventus Health Limited, પુષ્પવૃત્તિ સ્વાગત કરશે. So without wasting time now, I would invite our speaker, Mr. Roy Cherian, to present his presentation.
Good evening, all. I'll be speaking a little on English in the next year. Let me come to the first slide right directly. This is a disease. Louis Pasteur discovered a vaccine 125 years ago. But even today, this disease is not managed or eradicated in the world. You could eradicate smallpox. You are trying to eradicate polio. You are trying to eradicate some of the tropical diseases. But rabies, even today, the world is not able to eradicate. Why? क्यों? Because ये जो वायरस है, It is not in the human civilization. This virus is in the jungle and the forest. जब तक जंगल में फॉरेस्ट में रेबीज वायरस रहेगा, ह्यूमन सिविलाइजेशन will continue with rabies disease. Our children, our grandchildren will continue to have rabies disease. The only alternative for all of you sitting as doctors here, the best way how to prevent this disease from occurring in your patients. That's the only thing you can do. Unless in the jungle you put a bait for rabies immunization of the wild animals, then only probably the world will be free of rabies. Otherwise the world cannot be free of rabies. So thanks to this gentleman, we discovered the rabies vaccine, the Dr. Louis Pasteur, and here 125 years ago. Next. Now this is an important slide from my side. Normally, जब कुत्ता एकदम काट के जब खून बहता है डॉक्टर के पास आता है. जब कुत्ता ने injured surface of the skin पर अगर लिक किया straight off, patient doesn't come to a doctor. But remember that lick on an injured surface of the skin also can cause rabies. And there are many cases in India where an injured skin was licked by a cat or a dog, the patient has developed rabies. But what we see in the patient's attitude is only when the blood comes, you are badly bitten on the face, neck, it runs to a doctor. So this is an important area. A lick also on an injured surface of the skin can cause rabies. Next. And then starts the trauma, the fear, the pain, everything for the family and for the patients. Not only the patient suffers, the whole family suffers along with the patient. Next. That is why we say protection should not be left as a matter of chance. It is not, जैसा अपन डाइस कहते हैं ना क्लब में, it is not like that एक injection, दो injection, तीन injection, चार injection. I have heard in Bombay City, doctors telling me, अरे आजकल एक नया injection आ गया, जो एक ही injection चलता है. क्या है वो? Rabies immunotherapy. And it happened in Niman's Bangalore that the interior doctor said that एक injection में काम होगा rabies immunotherapy. बच्चे को पूरा यहाँ पीछे सब काट के आया बच्चे को उन्होंने इंजेक्ट रेबीज इम्यूनोग्लोबुलिन इंजेक्ट किया सब जगह पर एक छोटा सा घाव था पीछे where he forgot to give it and in that small injured surface in the back the virus started multiplying and finally the patient died of rabies. Niman's Bangalore. So we have such instances of educated doctors telling me that आजकल एक इंजेक्शन में काम हो जाता है. So it is very important that we have to give full 5 injections in case of any animal bites. There is no 3 injections, please. What will happen is, I will explain to you later, when you give 3 injections, your immune protection is only 6 months. But when you give 5 injections, your immune protection of your patient is lifelong. So that's important to understand. Not 3, but full 5 doses has to be given. Next. There is only one rabies survivor in the world. That's Gina Lees. This girl of 17 years, she was मंदिर में प्रार्थना कर रही थी USA में. तो small bat, I don't know in Hindi what you say for that. A small came and bit her hand. She did not go to a doctor because she did not see any bat biting. But after a few months she developed rabies. And US medical team did a big research on her. What they did is, they made her completely brain dead by giving ketamine injections, antiviral drugs, interferons, and they never allowed the virus to move from the hand to the brain. And finally, they could control the virus in the arm. They did not allow the virus to move to the brain. Because all rabies virus, the final attraction is the brain. That they did not allow. And finally, this girl, after 3 months of intensive medical care, she was comatose for almost 2 months and a coma. She was there, she came out of rabies, and now next slide. And now last year I got this photograph from United States. This is a father and a mother. She has graduated from college with a good marks and percentage also. That girl is the girl who developed rabies disease. Next. मुझे एक क्वेश्चन डॉक्टर सभी पूछ रहे हैं this animal bites, क्या होगा? A small rat bite, क्या होगा? A cow bite, क्या होगा? Camel bite, क्या होगा? Any animals which are four-legged animals, which are warm-blooded animals, or which delivers a baby, can cause rabies in your patients. There are only three species which does not cause rabies. One is your birds, second is your snakes, third is the small rats, small, एकदम छोटा rat जो घर पे देखते हैं, not the big ones, the small ones. And fourth is they say some of the squirrel and the rabbits don't cause rabies. बाकी सब animals can cause rabies. So this is important. Most frequently caused rabies is dogs. In India it is dogs, cats and monkeys, followed by cows, buffaloes, mongoose, foxes, wolves, jackals, sheep and goats. Rarely the bears, pigs, donkeys, horses, camels, and not reported in India is the bats. अभी इंडिया में bat rabies does not, कोई पेशेंट आके बोला कि bat खाता है, there is no need of rabies. 100 साल से कोई पेशेंट मरा नहीं bat rabies के कारण इंडिया में. पर अमेरिका में bat rabies is the major killer of rabies. फर्क क्या है? The only difference is the US bat rabies is carnivorous or lives on the blood of animals. The Indian bats are fruit-eating bats. Therefore, there is no rabies in Indian bats. So don't worry about rabies in bats. Birds don't cause rabies. Squirrel doesn't cause rabies. Snakes and the small rats. Small rats don't cause rabies. But the big bandicoots, जो बोलते हैं ना जो बिल्ली जैसे लगता है बड़े cats, that has caused deaths in Bangladesh, in Sri Lanka, Thailand, and in some parts of the Asian countries. So it is important that you treat with the big cat bites, rat bites, you have to treat a rabies vaccination. Human deaths in Asia, the capital of rabies death is India, with 20,000 deaths in the world reported every year. बाकी कंट्री आप देखिए चाइना, जो लाल कलर में है वहाँ नीचे, with more population than India, reports only 3,000 deaths. So India is definitely the capital of rabies in the world. Next. So what is the rabies virus? It's a bullet-shaped virus which belongs to the RNA virus group. But what is important about this virus is it is readily inactivated by sunlight, ultraviolet radiations. I have underlined this word, lipid solvents and various antiseptics. I will come back in the next slide for this explanation. Next. Now, how does the virus transmit from animals to human beings? The first, if you see a broken skin, a bite, yes, the virus goes from the animal saliva to the human beings. Number two, if you see, is intact mucosa. अगर कोई बच्चा कोई stray dog से खेल रहा है, and the stray dog licks the face of this child, and if the stray dog is carrier of rabies, the virus can enter through the saliva, through the mucosal layer of the mouth, or through the mucosal layer of the mucosal of the eyes, mouth, the virus can enter. I have a very classical case history in Bombay. A municipal corporator, his son was watching the TV. He had two pet cats in his house. एक दिन रात को one of the pet cats came on the sofa and licked this boy's face. And this boy had a lot of pimples and broken pimples. He used to break the pimples. And through the pimple, the virus entered, and this boy of 17 years dies of rabies in Cave Hospital, Bombay. The only son of his father and mother, and he had 2 daughters. So a lick on a pimple from a rabies cat caused death in this boy of 17 years. So we have instances of this type of things. That a lick. Now why I am explaining you the second picture. You remember what is important in India? Our children, they adopt a stray dog as a pet dog. घर पे लेके आएगा, खिलाएगा, they will play with the dog, and then this pet dog goes outside the house and mixes with the stray dogs. And somewhere down the line, if the dog gets rabies, he comes back to this house and passes on the rabies to a child. That is why they say that if you are owning a pet dog, please be under tight control. Do not allow it to roam on the road, so that there is a chance from a stray dog the virus can enter the pet dog. So that's called that. उसको कहते हैं कि community dog. जो पालता है वह बाहर जाके दूसरे डॉग से खेलते रहते हैं। Organ transplantation. Country like USA, 17 deaths in US, 17 deaths were reported because of organ donation from a rabies patient to a healthy patient. We have reported in Germany and US 17 deaths. Why? Because in US the death was not of typical hydrophobia type of rabies. It was more of a paralytical rabies, and the death report was that stroke patient and the organs were transplanted. 70 people have died in this organ transplantation. Bad fight we discussed. There is nothing to do for India. The bad fight. Next. Now, how does the rabies virus infect your patient? When the patient is bitten on the leg, अगर यहाँ कुत्ता काट रहा है, the virus enters in the leg. Then the virus starts multiplying in the muscle here. And number 3, the virus, after multiplying in the muscle, it infects the nerve endings of the peripheral nervous system. And then it moves by a retrograde transport. Retrograde transport means the rabies virus, if it is bitten here, it will not go down. It will only move towards the brain. And number 4, the virus replicates in the dorsal root ganglion here and then travels up the spinal cord to the brain. The brain is infected, and then the virus moves from the brain to the nerves and the other tissues such as eyes, kidneys, salivary. In fact, all the organs of the body is infected with rabies virus except blood. There is no viremia. So blood is not infected with rabies virus. That's all parts of the body is infected. Next. This is a picture which we are showing you to understand it better. The virus entry, moving up to the peripheral nerves, upwards, entering the spinal column, and then dorsal root ganglion again multiplying. Then it moves upwards to the brain. Again multiplies in the brain. From the brain, it infects all the organs of the body. Salivary glands, every organ is infected. In fact, it is secreted in this. Next. In all body fluids except blood. So what is the role of vaccine in rabies prevention? You can say, आपको अगर patient को बचाना है तो एक ही चीज है, you are to give the vaccine when the virus is in the muscle. वहाँ से अगर peripheral nerves में virus जाएगा, no doctor or God can save this patient. That is sure. You can only save the patient when the virus is multiplying in the muscle. And this multiplication or incubation period takes between 4 days to 6 years. The average is 3 weeks to 3 months. Most of the rabies cases happens between 2 weeks to 3 months. But you have rare cases where the rabies happen within a week's time. When the bite is on the face, neck, head, or rabies has also happened after 6 years. In fact, I had got a call 3 years ago from the ENT professor of LKT Medical College in Bombay. She said the patient has been admitted to my medical ICU with a lot of breathlessness, flu-like symptoms, and we were treating him for breathlessness. Then they did a tracheotomy of the patient. And after doing tracheotomy, the patient was not improving. Then, when the patient was given water, he says, I don't want water. The fear of hydrophobia came. That is the time when they understood this patient has developed rabies. Then they asked the patient, आपको कभी कुत्ते ने काटा है या कोई जानवर ने काटा है? बोला मैडम 2.5 साल पहले मुझे एक कुत्ते ने काटा था. 2.5 years पहले एक कुत्ते ने काटा था. And that rabies infection happened after 2.5 years. So this is important. It has happened in the medical college also. We had another case in KM Hospital again, and Dr. Parulike was the dean of KM Hospital. A pregnant lady who came for a delivery, delivered the baby, and then she developed rabies. Again, Dr. Parulike called me in the office and he says, I want 50 vials immediately of vaccine. Can you send it to my RMOs and my nurses? When we asked the case history, this lady who was pregnant was bitten by a dog 1.5 साल पहले, 1.5 years ago. So we have cases in Bombay City itself of long duration after dog bite developing rabies. What is the importance of this? कि आपको अगर एक पेशेंट आ गया बोला कि 2 महीने के बाद आ गया सर मुझे कुत्ता काटा है मगर मुझे अभी डॉक्टर बोला कि वैक्सीन लेना है, you may have to still give the vaccine. You cannot say that don't give the vaccine. It's over. 2 महीना हो गया चलेगा. You may have to give the vaccine because the virus may be still lying in the muscle. Because the virus has the viral load. Something called viral load in the bite. Saliva of a dog is not full loaded, always 24 hours with the virus. There is a peak and valley. जैसा ऊपर नीचे रहता है. Suppose the viral load is less, then the incubation period will be long. Suppose you are driving a motorcycle और आपने अच्छा thick jeans pant पहना है और उसके ऊपर वायरल कुत्ते ने काटा है, तो the viral load is less. But if you are wearing a half pant and while going on a motorcycle and आपको वहाँ का naked skin पे काटा है, तो the viral load is more. So this is another area one has to understand. The incubation period depends also on the viral load of the rabies virus in the dog saliva. This is also important. So that is why we say that multiplication in the muscle is the only stage where the doctor can save his patient. It's a very slow moving virus. It moves at the rate of 3 millimeters per hour. 8 in male rabies virus, the movement is only 6 centimeters to 10 centimeters. उसके ऊपर it doesn't move faster. That is why the incubation period is long, and that is why you can save the patient with a vaccine. Remember, rabies vaccine is the only vaccine in the world which is given after the infection sets in. Rest all vaccines you have to take it before the infection sets in. Why? Because of the long incubation period, you can still save your patient. Next. So this is one of the studies for Verora which we did in Thailand in the year 1985 when we launched Verora in Thailand. We found that the number of number of weeks after you get rabies was from a range of around 1 week to almost more than 1 year. And 46% of the patient develop rabies after 1 year. 3% of patients develop rabies after 6 to 12 months. And 3% of patients also develop rabies within 7 to 10 days. So it can vary between 7 to 10 days to more than 1 year. This is way back in 1985 when we launched Verora in Thailand. This study we had done with the help of WHO. Next. But I got a recent report last year from NIMANS. A man dies of rabies 25 years after dog bite. 25 साल के बाद ही आदमी मर गया रेबीज के कारण. And this is confirmed by NIMANS Bangalore. NIMANS Bangalore has confirmed this there. Next. So what are the clinical features of rabies? Well, it is important to understand this first phase, prodromal phase. This phase when a doctor finds it difficult to diagnose the patient of rabies. क्योंकि patient जब आएगा आपके पास, he will come with itching and pain at the site of the bite. जहाँ काटा है वहाँ एकदम कुछ नहीं बोलेगा, एकदम इतना कुछ नहीं है कि कभी ब्लड भी आ जाता है. So much itching is there. Number 2 is numbness and tingling at the limb. पैर में काटा तो वहाँ तो numbness and tingling complaint है. And then the patient complains of flu-like symptoms, malaise, slight mild fever, anxiety, headache. ये सब चीज complaint करता है. तो आप क्या करेगा? You may write an painkiller and an antibiotic, send the patient back home. After 2 days, he is not feeling well. He changes doctor sometimes. He goes to another doctor, and then he thinks that okay, this happened to a doctor in Kolhapur. Patient came in after 3 days. He came, doctor, panka banka, close the fan. The fan is hurting him. Then he had a doubt. He brought a glass of water. No, I don't want water, and he ran out of the clinic. And that's the patient who was developing rabies. But the first symptoms of the prodromal phase was this. So the doctor missed